Hi, everyone. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. We are here to talk about when you know something's wrong, but you're not sure what it is. This discussion moves us forward into the idea of geriatric syndromes, things that happen in medical care, things that you may be seeing with your elderly parents and you don't know what to do about them or you don't know the effects. We'll talk more about medical terms, medical terminology, how to notice these syndromes, and more importantly, what to do about them. This takes us one step forward in the process of navigating healthcare and working with the medical system. Let's start with our usual housekeeping. I use the term elderly parent or elderly parents throughout. Substitute this term for the person that you provide care for. The outline for this module is in the course materials for the program. Print the slide handout so that you can take notes. I will occasionally ask you to pick up your pen, make some notes. The ellipses, those dots you see on the slide are there on purpose to help you follow along with me. Let's talk about the objectives for geriatric syndromes. At the end of geriatric syndromes, you should be able to demonstrate an understanding of the medical terms: frailty, failure to thrive, and geriatric syndrome. Because you may hear these. Doctors that your elderly parents may see may talk about this to you without really giving you a thorough explanation. You should also be able to recognize how one or parts of geriatric syndromes can result in the need for more care if we don't catch it early, if we don't address it, and honestly, if we don't even know what we're looking for. So let's do a little more medical speak terminology. This section is going to contain a mini biology lesson to help you visualize how the body works and how declines happen with age, beginning at the age of 30. We've talked about how our physical strength, our balance, our muscle mass, how we lose that beginning at the age of 30 if we don't do anything about it. We're talking about this so that you can notice causes of health concerns and discuss, again, keep talking to your elderly parents about all of these. Frailty, geriatric syndrome, and fail to thrive are three medical speak terms that you will hear from healthcare professionals who may be examining your elderly parents. Frailty, it's defined as difficulty or impairment with mobility, balance, muscle strength, and memory. Does that sound familiar? It's a refresher. Physical endurance and physical activity. Frailty, more than the other two terms, geriatric syndrome and failure to thrive, relates to physical strength, the ADLs, the IADLs. Physical strength supports walking, physical activity, balance, and muscle strength. Physical activity promotes blood circulation and oxygen throughout the body, which is good for the mind. We talked about the importance of blood circulation and oxygen before in preventing ischemia. Do you remember what ischemia is and what it can cause? Ischemia can cause, if it is in the brain, it can cause dementia or memory loss. If it is in the stomach from smoking, it can cause tons of tummy issues and gastrointestinal issues. So, for example, how do you perk yourself up? If you're tired and you go out and take a brisk walk, your body perks up, it wakes up. You don't feel sluggish or tired anymore. That feeling of waking up is because blood and oxygen is circulating throughout your body and your brain. Low or weak physical activity can lead to disability and a reduced ability to perform basic activities of daily living. The less active we are, the more tired we can feel. How many of you have elderly parents who sit all day in a chair and they complain about being tired? Let's say that you're sitting at work and you start to get a little drowsy. Take a 10-minute break. If you can, go walk a couple of flights of stairs. Go outside, take a 10-minute walk. You would be surprised how your body and your mind will wake up. So, what are geriatric syndromes? That is the next question. Geriatric syndrome, it's not an easily defined term, although it's frequently mentioned in respect to the elderly. The simplest explanation is that it doesn't happen from one chronic disease or one health diagnosis. Geriatric syndrome is like this storm. It's like this storm of health events that group together and they become bigger and bigger and bigger. Many body systems are involved. Multiple body systems are involved in geriatric syndrome. An example of geriatric syndrome, you might want to jot these down, is, let's say an elderly parent has dementia. Add to that a urinary tract infection. Add to that delirium, which is a state of mental confusion. Add to that incontinence. And add to that a fall. Add to that your elderly parent may be depressed. So the effect of all of these parts and pieces coming together create this perfect storm that turns into a geriatric syndrome that usually results in being admitted into a hospital, into a nursing home. It can result in increased disability, and sometimes, if not caught early enough, it can result in death. So let's do a little bit of a biology lesson. So here's the biology lesson that I promised. It's slightly technical, but it's relevant. The longer that we live, because we are more likely to acquire chronic diseases if we do nothing, the more our organ systems rely on each other. So if you look at this chart, the body has a number of organ systems. The one that we're going to talk about is top row, third from the left. So the integumentary system, it is your skin, your hair, your nails, your glands, and your nerves. You could have your skin having different conditions. Maybe you have skin tears, maybe you have dermatitis, your hair could fall out, you might have problems with your nails, issues with glands and nerves. Then the muscle system, which is the little body to the left of that, that's just all of our muscles. Then we have the skeletal system, which is our skeletal system is the bottom row far left. That's just our skeleton. That is our bones. So osteoporosis can make us more likely to fracture bones. Arthritis can get into our bones. We then have the nervous system, which is the top row all the way to the right. Those are just nerve cells and fibers. We can get pinched nerves. We can have all types of issues with the nervous system. The circulatory system is the one below that, so bottom row far right. It's the heart, the arteries, veins, our blood, everything that circulates. You take that walk outside, your circulatory system starts pumping. Then we have the lymphatic system. Top row, the guy with green. That's our immune system. Our fluid balance, how we absorb fats and nutrients. It's the system that fights off illness when we get sick. The respiratory system, which is our lungs, bottom row, fourth to the right. That's our lungs and our breathing. The endocrine system manages, so top row, second from the right. They're glands that manage our hormones. And for women, super, super important. And this is our thyroid. If your thyroid is off, oh my gosh, your body can just go into all kinds of havoc. Then we got the urinary tract infection that removes waste from our body. Reproductive is human reproduction. The digestive system is our tummy. So it helps absorb foods into our body. All these systems work together. So what you'll notice is when one system begins to have an issue, it more than likely affects another system. So let's talk about how these link together and result in geriatric syndrome. Because as we talked, so our elderly parents could have breathing issues. That's respiratory. They could get a urinary tract infection. That's the urinary system. Their thyroid could be off. That is the endocrine system. So all of these work together. So what leads to geriatric syndrome? Again, you want to pick up a pen because I'm going to list some of these. And we talked about these, so this should be a little bit of a refresher for you. We talked about these in the last slide, and I did give some examples. So bladder control problems like urinary incontinence. Again, incontinence can translate to a urinary tract infection. If our parents are incontinent and they use Depends and they don't use a good job of cleaning, it's easy to get skin infections or skin rashes or to get open sores on the bottom. So one activity affects the next. Difficulty sleeping at night or feeling sleepy during the day for our elderly parents is another syndrome because of, do we remember? Low physical activity, low muscle mass, poor nutrition, and add to that the diagnosis of one or more chronic diseases. These all result in just being tired and being exhausted all the time. Osteoporosis, like we saw on the last slide, all those bones, relates to the idea of physical frailty. It connects to arthritis, difficulty moving around, a higher likelihood of falls and fractures. Then we add into this the spiral of weight loss, which is very common in elderly parents. Do you remember the connections here to weight loss? Low activity, don't have an appetite. Your parents say they're not hungry. They don't want to eat. They may eat like a bird, or they could be overweight. They're taking in a lot of calories, but none of those calories have any protein in it. The body needs protein to maintain our muscles and to maintain our physical strength. Elderly parents who forget to eat, don't want to eat the wrong things, they can also become dehydrated and they can experience delirium, which is mental confusion, and that results in hospitalization. Then let's talk about the importance of dental care. Issues with oral hygiene. That include brushing our teeth, cleaning dentures, flossing, all of that. That can result in dental decay, which is a chronic disease. It can result in perio disease, the possibility of losing teeth, the possibility of having to wear dentures. Wearing dentures affects nutrition because it affects the ability to eat and chew. If someone has memory loss, so reduced cognitive ability, that can affect swallowing issues and chewing that can lead to choking, that leads to pneumonia. So all of these body systems, they work together for the best possible situation. They unfortunately work together to create bad situations. As you can see, one small issue here affects another body system, and it can result in more illness and more frailty. Let's talk about failure to thrive. Now that you know that aging and becoming physically frail is a choice because we choose not to be active, what are you doing about it for yourself and for elderly parents? Failure to thrive is a term that has been around for years. It affects about 5 to 35% of aging adults living in their homes and 25 to 40% of nursing home residents. It's another diagnosis that relates to having one or more chronic diseases. It's described as a syndrome showing weight loss. So mostly it's noticed by weight loss greater than 5% and a low appetite, poor nutrition, and just being inactive that can then be accompanied by dehydration because we're not drinking, depression because we're not doing anything, and a low immune function. So our bodies can't fight off infections and chronic disease if we're not taking in any protein and all we do is sleep all day. Identifying signs of frailty, geriatric syndrome, and failure to thrive early is vital to helping elderly parents remain at home, avoiding hospitals, and avoiding nursing homes. If you're married and you have one set of elderly parents who need care, and the other seemed to be relatively independent, share the information with both of your parents so that you are talking to them about things you know that can happen so that you can prevent these type of health declines. Because what you don't want to have happen is you end up in this position where you say, oh, I don't know about that. Nobody told me about that. That is why you are here. That is why I am here, because I want you to be aware of everything that can happen and how that you can stop it. And I'll share another story. So a group of brothers and sisters who contacted me because mom lived in a little apartment behind their house. And that was their way of allowing mom to be independent as possible. She had her own little place, but yet she couldn't really take care of anything. And the kids were shocked because they took her to the doctor, and the doctor's like, oh my gosh, your mother has failure to thrive. And the kids are like, oh my gosh, we didn't know what that was. And they didn't know the effects, and they didn't know how it could spiral. So for this lady, she was pretty severely affected. We had caregivers that went in 7 days a week, and they went in a couple hours in the morning, a couple hours in the middle of the day, and a couple of hours of the evening. And fortunately, this was a family that had multiple working children. Mom still had some money, so they could afford to pay for care. If you're not in that situation, you may have to be this caregiver that works with your brothers and sisters to do shifts. But the goal was we needed to get her eating 3 times a day, having protein. So protein supplements, other things like that. We talk more about this in the section called Activities of Daily Living. So 3 meals a day, 3 good, healthy meals a day. 3 times a day, we did exercises, or we went out for a walk, or we did something to support the idea of being hungry. Then we also did some strength exercises that were prescribed by a physical therapist, because when you're trying to reverse failure to thrive, you have a number of things that you're working on. You're working on eating, being hungry, better nutrition, physical activity, strength. You're working on mood to like boost the mood, to get rid of the depression of sitting in the house all day. This actually worked for this client. It works for many clients. But again, it's going to take a little bit of time. It's going to take a few weeks to start seeing any changes. We actually weighed this client 3 times a week to see, oh my gosh, is she gaining weight? Are we losing weight? Are we making progress? So we came up with physical measures that said, oh my gosh, we gained a pound this week. And we walked 2 miles this week. And look at all the great things that we did this week to keep this woman motivated and to let her family know that we actually were really making a difference. You can make a difference. These syndromes, they're bad. They're not good for elderly parents. They exist. But it's learning about the syndrome over here, and then it's what you actually do about it over here to solve the issue. So not knowing is a spiral to further decline. It's important to know about these so that you can come to this side and manage them. So let's talk about noticing this combination of events. As we talked, frailty, geriatric syndrome, and failure to thrive, they're syndromes that result from chronic diseases. How many of you remember the statistics on chronic disease? Let me share them again. So 60% of older adults have 1, 40% have 2. These are optional. We don't have to have chronic diseases. Chronic disease results in general weakness, decreased physical ability, more sickness, more infections, urinary tract infections, hip fractures, sleep problems, weight loss, skin wounds, a long list of issues that make it more difficult to care for elderly parents, takes more effort to help them remain at home individually, which leads us to the next big question and the next big issue. You might meet with doctors who are not proactive in talking about health issues or solutions for elderly parents because they just think that they're old. I have had so many situations, unfortunate situations, where doctors would tell me that my clients, my patients, they would say, oh, honey, he's old. Let's not bother with this. Let's just let this happen. And I knew that that was not what my client wanted. I had to disagree with the doctors. I'm like, well, you know, he may be old to you, but he's still maybe old over here. He has some value. He wants to live. He wants to improve. So give us the suggestions. We'll follow them. We'll follow through. You're going to find some physicians are biased against care for elderly parents. For that reason, they think they're old. They think there's no hope. If it was a 20-year-old, oh my gosh, they would be beside themselves doing everything they possibly could to help out this 20-year-old. But an 80-year-old, it's a different situation. That's why you have to stand up and advocate for your parents to get the care that they need. So the medical system, as we talked, can become biased about healthcare for the elderly. Caregivers, though, can also become biased. You can just think, well, my parents old, they don't deserve any care. I'm not going to do anything. This is just the way it is. It is not. It does not have to be that way. I have an entire Caring Generation podcast. It is called, Is Health Care Forgetting the Elderly? And in there, we talk about the bias of, family caregivers and how they also can cause similar problems. You don't want to be that person. This lack of attention by the medical system and sometimes by family caregivers creates this spiral of hopelessness and helplessness until we realize that we have to interrupt the process. We got to stop that gap and do some positive things to turn this around. That's when you as a caregiver can find yourself faced with a combination of these events that have just come together to be the perfect storm, but you can change this. You working together with your elderly parents can totally change these situations. Again, it is up to you to do that. How attentive are you to health? Now that we know about frailty, geriatric syndrome, and failure to thrive, what can we do about it? Well, being attentive, being vigilant is the first solution. Many of the physical and mental declines that have culminated in this perfect storm, they happened over time. They just didn't happen overnight. They happened over days, weeks, months, sometimes years. Because the issues are gradual, we don't notice them until they become this significant storm, and now we have all these health issues on our hands that we don't know what to do with. Being inattentive to small changes can make it difficult for us to notice when our parents start to struggle. Our elderly parents may hide things from us because they don't want to complain. When asked, they'll say, oh, honey, we're doing fine. Everything's okay. Nothing's wrong. Or we don't need any help. Don't worry about it. Sometimes it takes a severe illness or an emergency hospitalization to bring attention to the seriousness of a situation. Parents who are not proactive, who don't go for regular checkups, who don't get their annual flu shots. Parents who are not proactive in seeking regular medical care, they may even have health issues that you don't even know about yet. The same condition of seeking regular medical care applies to us as caregivers. How attentive have you been to your health? When was your last full checkup? If you haven't had one, schedule it. The health and well-being of caregivers suffer when we take care of elderly parents. The risk of being attentive is that we can manage this instead of having everything snowball. Sometimes we're not paying attention. We need glasses. All of a sudden we have high blood pressure. Then we have high cholesterol. Maybe we have another diagnosis. All of a sudden, us as caregivers, we're feeling pretty darn old. If you are lucky and your elderly parents don't yet have all of these conditions and they're not frail, do what you can to give them a little help. Engage them in activities to prevent these health declines. That should be your mission in life. On the other hand, if they've entered into the stage of being frail, they have geriatric syndrome, failure to thrive, develop that plan. Working with them for consistent day in, day out actions, it can slow all these health declines, can turn everything around. So let's talk about the summary of these slow declines that we see in elderly parents. One component of avoiding frailty, failure to thrive, geriatric syndrome is ongoing medical care. It's those checkups, it's the vaccinations, it's all of that we will talk more about. Noticing these little things before they come big, huge, huge thing that you should be noticing. We can prevent so many of these things that happen in our elderly parents if only we take action. I'm Pamela D Wilson, caregiving expert, advocate, and speaker, your host of this program. It is my pleasure to be with you to share these webinars. Stay with me, take some notes, come back, watch the next webinar. We'll be back in just a few minutes if you choose, or schedule another time to watch the next webinar and continue with this series. I'll see you again soon.